Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar about Lyme disease, and you create them with your questions each week. I just provide the answers, but it always is interesting. Some weeks we actually get into a theme of the week where there's a lot of questions that fall in a certain category. That's not by plan, but it sometimes does happen. For those of you that are here again to see this again, welcome back. I'm glad to see that you keep getting value out of it. And for those of you that are new, this is a webinar you create. And the way you do it is over here on the right-hand side of the screen down there at the bottom is a chat box. And you can write your question to me through that chat box. The only thing I ask is that as you're writing the question, do not hit the enter key until the whole question is done. The other thing, because if you do, that sends multiple questions my direction, which gets to be really hard for me to decipher from my side of the webinar, okay? Second thing, this format works well for briefer questions, not ones that take forever to write, okay? And that is, if you write really long questions, I may not be able to post them, because if I do try to post them on the screen, it will lock up my computer, number one. Secondly, long questions are hard to read and for people to listening into these to actually take in, okay? So just keep that in mind. If you really have a really complicated question, one of the things you might want to consider doing is actually trying to consult with me. And I'll show you how to do that as part of the visit tonight, how you could set up a consult visit where I could give you a detailed answer to a complex question, all right? All right, so tonight I am creating a recording as usual. And you will get an email from me in the morning saying that recording is ready to go. Usually that email gets out somewhere around 9 to 9:30 a.m. Pacific Standard Time. And did you notice I said usually? So that's if I don't have any technical difficulties, which occasionally I do, okay? But I usually try to clean up the video just a little bit before I send it out to you, do a little bit of editing, and that is something actually I take care of after the webinar is over tonight. And sometimes I do run into some technical glitches on that, okay? All right. And let's see, what else do we got here? In terms of if you happen not to get the email, there's a few places that you can actually see this recording, okay? So one of those places that you can go, and I'll just show you here real quick. Okay, so one place you could go to see the recording is at my supplement store, which is Marty Ross MD Supplements. And if you scroll all the way down here, you can see that I post the last recording, okay? Another place you can find it is on my Lyme disease information site here at treatlyme.net. You can find it two places. You can either go down here on the homepage, or you could click on the Q&A webinars up above here and find it down here at the bottom. And then finally, I am posting these on my new clinic webpage, and you can find it on the homepage down here about halfway down. Okay, all right. So those are some places. The last place that you can find copies of my recording are actually on Facebook. I will post a link to the recording on Facebook each week as well too. Okay, all right. So that gives you plenty of places to find it. So without any further ado, let's go ahead and get started here. During the webinar, for those of you that are participating in the live version, I do post the questions that are asked so that you can actually see them, okay? And so you're going to be able to read these on your screen. Those of you that are participating in the recorded version, though, unfortunately, are not going to be able to see the question. They don't show up in the recorded version. So for that purpose, I will actually read the questions too, okay? All right, so let me go ahead and post this first one. This is from Steve. Hi, Steve. Let's see. Hi, Dr. Ross. Babesia, or is Babesia the worst strain of the big three in your opinion? I had my blood taken 1 month ago after being bitten, came back as having a Babesia marker. Then I had my bloods taken again after 6 months, came back as totally negative for Borrelia burgdorferi. So it looks like I have Babesia, as when I walk the dog, I come back totally soaked in sweat, even on a cold day. I've just started a course of Disulfiram, so would like to know your opinion if it would be okay to add artemisinin and malarone at the same time. Would these add an extra dimension? Also for herx and detox, you recommend glutathione and curcumin on your website for other treatments. Again, are these okay? to take whilst on the disulfiram. That whilst kind of gives you away. I think you may be somebody possibly from the UK. Maybe you're from the US, though, and using whilst. But anyhow, I'd be glad to help answer your questions here. All right. So in terms of the big three, I think by that you mean Lyme, which is Borrelia, Babesia, and then also Bartonella. Okay. So these are all infections that can be transmitted by tick bites. Sometimes people get these three. So for instance, on the East Coast here in the United States, there are studies that suggest that around 70% of the ticks that carry Lyme carry at least one co-infection, and about 50% carry three co-infections, being the big three, okay? In terms of what I think is the worst one, I think it's all very individual. There are some people that any of these infections are easier to get out of, and some that they're not. All of these infections have complications. The Bartonella, although I think we are capable of eradicating Bartonella. I know some of my colleagues don't think so. They may be treating it different than I do. I don't know. But Bartonella is one of those you can't get into relapses. And we do know that Bartonella, at least based on some of the more recent research by Ying Zhang and some of his colleagues at Hopkins, he's showing that Bartonella has the ability to form into what is known as persister forms, or he calls them stationary forms. We know that Lyme, one of the reasons it's hard to treat is it also can form persister forms. And so perhaps Borrelia and Bartonella are the hardest ones to treat. Basically, what a persister form, everyone, is a form of the germ that develops when it's been exposed to antibiotics for a while. And in these persister forms, they move into biofilm communities, and also they basically go into hibernation and just start ignoring antibiotics, okay? So it makes it harder to treat them when they're in a persister form like this. I mean, we know that Bartonella and Lyme can form persister forms, okay? So in terms of what's the worst, it really is dependent on the person, okay? All right, then let's see, second part of your question. So disulfiram, everyone, is a medicine we have historically used to treat alcoholics. That there is some recent research that got published, I think maybe a year or two ago now, that showed that it might have the ability, or at least in the laboratory has the ability to kill Lyme. We think it can kill persister Lyme, which is why it's gotten a lot of attention. A colleague of mine published a paper about a case study involving 3 patients he used disulfiram on, and it showed promise as being something that might be able to help treat persister Lyme. So we are all starting to use it in our practices to treat persister Lyme, and I'm getting some good results. I know a number of my colleagues have. I don't think it's the drug that's going to cure everyone with Lyme, though, just so you know, and I'll say more about that later, but it can be helpful. If you're wanting more information about disulfiram, take a look at my website where I've written a whole article about it. And that'd be some useful information. Anyhow, we think disulfiram is antibiotic against Lyme and persister Lyme. We also know that it can be antibiotic, or antimicrobial, I should say, against Babesia. Can you work with it using artemisinin and Malarone at the same time? I think so. I wouldn't see a problem in doing that. Just be aware you may get quite a killing reaction from doing that, okay? Let's see. Also, for herx and detox, you recommend glutathione and curcumin on your website for other treatments. So yes, for herxing and detox, it would be okay to take disulfiram with glutathione and curcumin. In fact, to limit the severe Herxheimer reactions that people get on the disulfiram, those are the 2 additions that I have been making in my practice. I've been using those 2 herbs to limit the Herxheimer reaction that people can get from being on the disulfiram. Okay? All right. So I hope that answers your questions, and thank you for that. Thank you for those 3 major questions there. All right. Next question is from Lee. Hello, Lee. Let's see. The only symptom I have left is intermittent leg aches. It feels sort of like I exercised the day prior and I'm feeling sore. It comes and goes. Does this point to Lyme or one of its co-infections? Also, any advice on how to get rid of this symptom? My second question is, can you take sida, acuta, and coartem at the same time? Okay, so So sida acuta, everyone, is an herb that you can use to treat Bartonella and can treat Lyme. Coartem is an anti-malaria prescription that we use to treat Babesia sometimes. I see no reason they can't be taken together. Generally, with coartem, you don't want to take drugs or herbs that would change the electrical conduction patterns of the heart. And I'm not aware that sida acuta does that. Okay, so I see no reason they couldn't be taken together. Let's see. And then as far as the intermittent leg aches, I do not assign leg aches intermittently to any one infection. If anything, leg aches I would think of as being, actually, let me rephrase that. I would think of leg aches as being more of a Lyme symptom. I usually do not see those as ones I consider as being part of Bartonella or Babesia, or the other chronic co-infections that sometimes people can get. Okay. In terms of advice about how to deal with the leg aches, one thing that you might want to try is a magnesium. Magnesium can be used to help relax muscles in the legs, and I like using it as about 600 milligrams at bedtime. The reason to use magnesium at bedtime is it makes you sleepy, okay? But magnesium, most of us probably have magnesium deficiencies if we look at studies about that in people. Also, the reason that could be happening, why people have a lot of magnesium deficiencies these days, is that our food supply is not rich in magnesium anymore. Most of our soil is depleted of good minerals, and therefore people are not getting adequate levels of magnesium out of their food. And so a good way to deal with muscle cramping, and even a good way to deal with headaches, is to be on a regular supply of magnesium. You can take up to 600 milligrams at night without any trouble. The problem you can run into sometimes with magnesium, if it is too high of a dose for you, is magnesium attracts water in the intestines. And if you're getting too much magnesium, what can sometimes happen is you're going to get loose stools or diarrhea. Okay, so you may want to be aware of that. Okay, all right. And if you do, just back down a little bit on the dose that you're using. Okay, all right. Thanks for our question, Lee. And good luck to you. Hello, Marta. Hello, Dr. Ross. Thank you for all your hard work. I have two questions. My husband, thank you about that, by the way. Let's see. My husband has Lyme plus Bartonella. After what time should he feel that antibiotics work? After what time should he change them if he doesn't feel any difference? I'm going to start by answering these one at a time. Okay, so first of all, question number one. So with Bartonella, if you are on a correct regimen that is working for it, you should start to see a change in the Bartonella symptoms, not the Lyme symptoms, but the Bartonella symptoms by around 1 to 2 months. If you are not seeing improvements in the Bartonella symptoms by 1 to 2 months, then it's time to think of a different combination of antibiotics or herbs, okay? So symptoms that make me think of Bartonella that I'd like to follow with some with Bartonella is symptoms of Bartonella can be pain on the bottom of the feet that is worse in the morning, and usually you can improve it as you walk. Anxiety, depression sometimes can be signs of Bartonella. Very poor thinking can sometimes be part of Bartonella, although that can be part of Lyme as well too. People sometimes with Bartonella have a lot of severe abdominal pain that can happen with it. And sometimes people with Bartonella get repeated new stretch mark rashes. You would expect to see those stretch mark rashes to not be occurring, new ones not to be occurring. The old ones may still remain, but you would expect not to having as much recurrence of those, okay? So the other thing sometimes people with Bartonella can get that's a good symptom to follow is daytime sweating. So you just want to follow those symptoms and see, are they gradually getting better, okay? In terms of the Lyme germ, Lyme's trickier. Lyme, if you've had it in you for a year or more, I consider to be a chronic infection. And if you've had it in you for a year or more, it can sometimes take months for those symptoms to improve. So there was a study that was presented to many of the Lyme doctors that attended one of the annual Lyme disease meetings in, I forget which city this one was in, but this was years ago, okay? And in that study, there were a number of people that there was a study done looking at how quickly people would get better when they were on Lyme disease antibiotics. And then the study used two. They used an antibiotic called Biaxin and one called Flagyl. And in that study that was presented, but it was never published, what was found is that by 3 months, 30% of people started having improvement. By 6 months, 60% of people started having improvement. And by 9 months, 90% of people started having improvement in their symptoms. Okay, so that's improvement. Okay, that doesn't mean all gone. And I hope you hear what I just said. What I said is by 3 months, 30% of people started having improvements. That means 70% had no improvements at all. Okay, so in other words, the Lyme infection can take longer. Okay, all right. Number 2, would you have any suggestions for the pain on the one side of the face with extreme photosensitivity in one eye? For the last 1.5 years, he tried gabapentin, carbamazepine, amitriptyline, similar drugs, as well as CBD and THC. Nothing is working. Light is causing the pain, as well as focus, reading, etc., and physical activity, even slow walk. Pain appears only during the day and never while sleeping. MRI and CT are normal. Kind regards, Marta. Okay, so that kind of pain you're describing is nerve pain, all right? And so the ways that the gabapentin and carbamazepine are medicines that are anti-seizure medicines. We sometimes use those for chronic nerve pain. And so he's already doing those without much benefit, obviously. So I don't. And then the amitriptyline is an anti-depression medicine that sometimes can help with nerve pain. And if those aren't working, those generally are going to be the ones that work. There are other anti-seizure medicines like Lyrica that can sometimes help. There are other anti-depression medicines like desipramine, imipramine that can sometimes help. So you may want to talk to the doctors to see if they'll keep trying other combinations of drugs. Sometimes for that kind of pain, we need to use narcotics, even though using narcotics these days is taboo because of how we got a lot of people hooked on them. But that's another option. And the THC. If those all are not working, the other thing you may want to consider is acupuncture. Believe it or not, something as simple as acupuncture sometimes can make a big difference for this type of pain. And that would be something to consider as well, too. Okay. All right. Let's see. Yeah, those are my thoughts for you. I'm sorry about that nerve pain. It could be really a debilitating kind of symptom, too. Okay. All right. Good luck to you, Marta. Good luck to your husband, actually, too. Lee Burley says hi. Hello, Lee. Thanks for saying hi. Hello, Lynn. Let's see. If an initial Lyme infection was treated with doxy and the patient got another tick bite 3 years later, is it safe to treat with doxy again, or should a different antibiotic be used to avoid resistance? Also, what is the reason behind sleep disturbances in Lyme? Hard to sleep at night, even though tired. What do you recommend besides chamomile tea? Okay. All right. So I'll be glad to help you with all that. So in terms of, hold on here, everyone, just a minute here. There we go. So in terms of the doxycycline, so doxycycline is probably the drug, or is the drug of choice, not probably, is the drug of choice for an acute tick bite. And the reason that it is the drug of choice is it can treat Lyme, but in an acute situation, it can treat other infections that can be treated by that tick, like it can treat anaplasma, Ehrlichia, Bartonella, and Babesia. And so it is the drug of choice in that situation. Now, are you going to develop resistance? Will the Lyme germ develop resistance using doxycycline for 3 weeks to 4 weeks? No, I don't think we develop resistance that quickly. And this is something I would do. I'd go back and retreat again. If you get a bug bite, again, doxycycline is safe to go ahead and use for when you get another tick bite. I would have no problem doing that in this kind of a situation. Okay. All right. Then let's see. So in terms of sleep disturbances in Lyme, the reason people have sleep disturbances in Lyme is due to the Lyme infection releasing or causing the immune system to release a bunch of inflammation chemicals called cytokines. And cytokines are good and bad. Okay, so first of all, cytokines are inflammatory chemicals that are made by white blood cells when they see germs. And they're made by white blood cells to fight those germs. And they do a few things. Number one, they cause more white blood cells to be made. Number 2, they help draw those white blood cells to where the infection is. And number 3, they help those white blood cells work better. Okay. Now, the problem is in Lyme, and the problem is when you have mold toxins in you, the immune system's trying to get rid of. And the problem is when you have chronic virus infections in you and the immune system's not doing a good job getting rid of them. And the problem is if you have chronic yeast overgrowth in the intestines, sometimes the immune system doesn't do a good job and it keeps trying harder and harder. And eventually it makes too many cytokines, okay? And too many cytokines disturb your sleep centers in the brain. They make it so you can't think. They give you body pain. They give you fatigue. They basically give you what we call Lyme symptoms and what we call yeast overgrowth symptoms and what we call mold toxicity symptoms and what we call chronic virus infection symptoms, okay? Notice how they all pretty much look the same and it gets kind of complicated to figure it out. It's because they have one common thing in common, and that is they all cause your immune system to make too many cytokines, all right? So one of the things so in terms of your sleep centers, the cytokines do disturb your sleep centers. And so ultimately to get your sleep controlled again, you're going to need to get your germs under control that are triggering too many cytokines, okay? In the short term, one of the things you can do is try to lower the cytokines. And one of the ways that I like to do the best is to work with curcumin. And I like working with a product made by Thorne called Mariva 500, which is liposomal curcumin. And the reason I like working with liposomal curcumin is in a liposomal form, it gets better absorbed and therefore can get to your white blood cells, where in the white blood cells, it basically blocks the production line of cytokines. It limits their production, okay? Second thing that I like to do, if that's not working well enough, is I like to add glutathione. And I like to add liposomal glutathione. And liposomal means it's microscopically wrapped in fat to increase its absorption, all right? And the product I like for that is a product made by Research Nutritionals called Trifortify Orange or Trifortify Watermelon. And I like to do a teaspoon a day, one time a day of those, okay? So that's how I lower cytokines. And if those things I just said also are how I try to control cytokines in my Lyme treatments, because limiting cytokines limits Herxheimer reactions, and decreasing cytokines will help your immune system work better too, okay? And when I use the Mariva 500, that liposomal curcumin, is 500 milligrams taken as a pill 3 times a day. And again, the glutathione would be 1 teaspoon, which is 5 milliliters, 1 time a day on that, okay? Those are some basic steps, okay? All right, now, if that's not working well enough, there are a variety of herbs that you can use. And without spending the time to go through it here, I'm going to just show you 2 articles to take a look at, okay? Let me do a screen share here. All right, so I'm going to go over to... All right, so we're back here at my Lyme disease information site. So what you want to do is go ahead and look at my online guide and take a look at the section on sleep, okay? And follow 2 things. Number 1, look at this article called Sleep in Lyme, the Basic Steps, okay? And one of the things I talk about is lowering cytokines, and I talk about it up here at the top, and I mentioned the curcumin and the liposomal glutathione. I talk about basic sleep hygiene steps you want to take, so I would look through here, and then you want to correct underlying causes like sleep apnea, anxiety, pain. You want to deal with those, okay? And if that's not enough, then you start looking at natural medicines or prescriptions, all right? All right, so for the natural medicines, you can click on this article here. And these is an article that includes my natural medicine sleep options. And you can read through this and it gives you information on that. Okay. All right. Let me go back here. All right. Very good. Thanks for the question, Lynn. And good luck to you. Hello, Dave. Let's see. Hi, Dr. Ross. Do you first recommend the antibiotic route for treating Lyme, natural supplements, or both together? Is there actually an antibiotic drug combo that is clinically proven to work for Lyme and co-infections? All right. So I'll try to give, this is maybe a long-winded response, but I am going to answer your question. Okay. So when it comes to treating Lyme, there are herbal combinations. There is an herbal combination that, in my experience, can work as well as prescription antibiotic combinations to treat the Lyme infection. Okay. All right. So I'm talking just the Lyme germ. I'm not talking Bartonella. I'm not talking Babesia. I'm talking just specifically about the Lyme germ right now. All right. So in my experience, what I have found is using the combination of otoba bark and cat's claw works about 85 to 90% of the time. That compares with any prescription antibiotic combination that will also work about 85 to 90% of the time when you take it orally. Okay. Now, notice how I said combination. The reason I say combination with prescription antibiotics is we need to treat for two forms of the Lyme germ, and we need to treat for Lyme living inside and outside of cells, okay? And to treat both the spirochete form of the germ, that's the corkscrew-looking thing, and the microscopic cyst form of the germ requires at least two kinds of antibiotics. There does not appear to be one that treats both of those, okay? So to treat for inside, outside of cells and spirochete and cyst forms of Lyme requires at least two prescription antibiotics, all right? Okay. The herbs otoba and cat's claw, I started using those based upon Petri dish experiments that were published about 6 or 7 years ago now, I think, by a researcher named Eva Choppy. That's SAPI. She's running a really good Lyme disease research lab out of New Haven, Connecticut. And she published reports that showed that those two herbs did a great job of killing Lyme on Petri dishes, and specifically getting rid of both spirochete and cyst forms of Lyme, and also getting rid of 100% of biofilm. Okay, biofilm is a slime layer that can cover the germ and blocks treatment, all right? So based upon her Petri dish experiments, I started using them clinically, and again, I find they can be worked as well as prescription antibiotic combinations, all right? Now, when it comes to the two main co-infections being Bartonella and Babesia, the herbal combination that I use is Sida acuta hootenea for Bartonella. That works about 75% of the time. And then the prescription combinations, of which there's a number you can use, work about 80 to 85% of the time. So in the case of Bartonella, prescription antibiotics seem to work a bit better than herbal antibiotics, all right? In the case of Babesia, I find that herbal combinations like using artemisinin and cryptolepis will work about 80% of the time, versus prescription combination antibabesial medicines work about 80 to 85% of the time. So I find just a little bit better chance of prescription combinations working for Babesia. Okay, all right. All right, now, is there actually an antibiotic drug combo that is clinically proven to work for Lyme and co-infections? So the only combination that is proven to work for Babesia based upon studies is the combination of atovaquone, which is called Mepron, along with Zithromax. There have been no other human studies done that I've been able to find that look at any other combinations. However, many other combinations do work, and I write about those based upon my clinical experience and the clinical experience of my colleagues. Okay, all right. In terms of Bartonella, there are limited human studies showing what works, especially what works in Lyme. We don't have any studies showing what works in Lyme. And then in terms of Lyme, the best researched antibiotic would probably be doxycycline. Amoxicillin has some evidence about it working in humans as well. I believe cefuroxime does too. But the truth is we don't have big studies showing what combinations work best on people, okay? So to answer your question, our research is really limited on humans about what works best, okay? All right, now I'm gonna do a quick screen share here. I wanna show you a number of things. All right, so let me go here. All right, so this is back at the Lyme disease information site called Treat Lyme by Marty Ross MD. You'll find it at treatlyme.net. In terms of what do I think works best and how do I put my treatments together, In terms of antibiotic combinations, take a look at a Lyme disease antibiotic guide, okay? In terms of recommendations I have for treating Bartonella, including prescription and herbal options, take a look at this article called Kills Bartonella. And in terms of herbal and prescription combinations that can work for Babesia, take a look at this one, okay? Now, again, as I was trying to say, most of what we do in Lyme in terms of treating what we think works is unfortunately based on clinical experience, because the dollars that are being spent on Lyme disease research seem to be focused more on looking at Lyme disease as being an autoimmune illness, or an illness where once you have a chronic infection, you don't get better, it's triggering immune system problems. That seems to be where a lot of the federal dollars are going these days. There is some foundation support now, money now going to looking at what do we do about treating persister Lyme, and a limited amount of research that's being done at the level of bench science, test tube science, petri dish science, but we don't have much going on, if anything going on really, at what the best combinations are to use in living humans, unfortunately. That's just not where the federal dollars are going at this point, okay? All right. Thank you for answering that, or asking that question. Hello, Angela. Let's see. Hi. I was curious your thoughts on treatment time for Bartonella with rifampin, Bactrim, and Doxy typically. Also thoughts on Disulfiram. Okay. So in terms of, again, I kind of answered this earlier. When it comes to getting over Bartonella, if you're on at least a 2-drug combination, whether it's rifampin and Bactrim, whether it's Bactrim and Doxy, whether it's rifampin and Doxy, or even a triple combination like rifampin, Bactrim, and Doxy used together, you can do that too. Again, it takes about 4 to 6 months to get rid of Bartonella, okay? And usually, though, if that's a combination that's working, you should start seeing good improvements by 1 to 2 months, okay? All right. All right, Disulfiram. Let's talk about Disulfiram real quick, okay? Well, it won't be quick. It's not an easy thing to talk about quickly, all right? So Disulfiram, as many of you are aware, is a new treatment for Lyme that has kind of taken the world by storm, all right? And so this is based on research that was done out of Stanford University by a researcher named Rajas, R-A-J-A-S, I believe that's correct. His lab has been looking at medicines that may be used for other conditions, trying to see if they might actually have antibiotic effect against Lyme, okay? And he's using a screening method called high throughput screening, where he can rapidly determine if these medicines that are found in the prescription data bank that we wouldn't ordinarily classify as antibiotics, he's been being able to look and see, could those classified as antibiotics and also those that have never been classified as antibiotics actually have the ability to treat Lyme? And one of the ones that he found is Antabuse, also known as Disulfiram. Okay, so this is a medicine that we traditionally have used to treat alcoholics. And what it does in alcoholism is it blocks an enzyme that is used to break down a byproduct of alcohol. If we don't break down that byproduct of alcohol, it quickly becomes something that's very irritating to a person, making them have doubled over abdominal pain and getting very, very sick, okay? So that's how we use it in alcoholics, is to make them sick from drinking alcohol, all right? Now, what the Stanford experiments tell us is it actually has antibiotic properties, all right? And so some people have postulated using it to treat persister Lyme. And I mentioned persister Lyme earlier, being Lyme that after it's been exposed to antibiotics for some time, some forms of that germ go into hibernation, slow their metabolism way down, and a lot of the forms move into biofilm communities, and we call that persister Lyme, all right? So there's a lot of research being done now trying to figure out what are we going to do about persisters. So what happened with this Disulfiram is a colleague of mine, Dr. Ken Liegner, was approached by one of his patients based upon this research I was telling you about. And he was approached that this patient wanted to try Disulfiram. So Dr. Liegner did decide to do this, and he did it on a couple other people, and he published in May of 2019 his report about the experience he had managing 3 people with disulfiram, okay? And these were people that generally had a hard time getting over Lyme, had persistent symptoms even after multiple rounds of being treated with various antibiotics, all right? So the way that Dr. Liegner did this in his practice is he stopped any other antibiotics and only put them on disulfiram. And what he found in his report that he published, one person he thinks he got into remission, basically. The other 2 had really good improvements, okay? Now, subsequently, Liegner then in the annual ILADS Lyme disease meeting in Boston in November presented more about his findings that he's had, and he presented on 31 patients, okay? And in these 31 patients now, he has 5 that he considers he's gotten into extended remission. He's got 5, I think it was about 5 or so that had to drop out of the studies because of side effects, all right? And I'll say more about that here in a minute. And then the other people all had various degrees of improvement, okay? Now, keep in mind with Dr. Liegner and his studies, Liegner does not use herbal supplements to control Herxheimer reactions. He doesn't use herbal supplements for any reason at all, okay? And one of the limiting factors on using disulfiram at higher doses that might be more effective is severe Herxheimer reactions, all right? So we have to kind of look at Liegner's results on his 31 patients with that in mind. He has a hard time pushing the dose up higher because he's not able to deal with the Herxheimer reactions that can occur. Also, Dr. Liegner did not put people on other antibiotics at the same time of using disulfiram, and maybe people get better benefits if we had them on other antibiotics at that time, okay? All right. Now, one thing about disulfiram, we think that one of the ways it can work is it's antibiotic based upon the Stanford experiments, okay? The other thing that might be happening that many people are postulating is that disulfiram actually has a chemical structure involving what are called sulfide bonds. It has 2 disulfide groups, okay? And sulfide is thought to be very effective at breaking down biofilms. So one of the reasons that people may be getting such acute Herxheimer reactions, maybe benefit from being on the disulfiram, is beyond just the antibiotic effect. It's that they're breaking down biofilms, making the germs more easily attacked by the immune system, and the antibiotic effect of the disulfiram or anything else we might have them on that's antibiotic, okay? All right, so disulfiram, in addition to treating Lyme, has the ability to treat Babesia. It's not clear if as a sole agent it would be effective against Babesia. And then what I would say is that on Bartonella, the jury's out. There are some of my colleagues that think they're getting benefits for treating Bartonella, and there are some that do not. And so it's not clear yet whether this is going to be something that is helpful with Bartonella, okay? Now, in my practice, and I have been using it the way that Liegner suggests in terms of starting up, and that is that you want to start somebody on a 250 milligram pill, but you want to quarter it and start every 3rd day. You do that for about 10 to 14 days. If they're not having big herxes, then you go up to a quarter pill every other day for about 10 to 14 days. And you keep working up in that fashion until you eventually get them to a target dose, okay? And the target dose is based upon body weight, and I still have to look up that target dose. But generally for a person that's probably going to be about 120 pounds, I believe they're going to want to get up to 250 milligrams a day. Don't hold me to that. I have to look at it. I assume when I finally put a thorough article together on this, I will include a table. So if this video is part of a table, this clip that I'm talking about right now is part of a table, I will include in there the target doses based upon body weight, okay? Now, with what Liegner was doing was about 4 to 6 months of using it. And again, he thinks he got a lot of his patients into remission. Okay, now, what I am wondering is if we could get more people into remission than what Liegner is proposing, if you can also do things at the same time to block the cytokines and the Herxheimer reaction effects, okay? And so in my practice, what I'm doing is not only am I putting people on the disulfiram, I'm also putting them on the Mariva 500 by Thorn that I talked about earlier, 500 milligrams 3 times a day. And if they herx, I'm having them take 2 of those 500 milligram pills 3 times a day. I'm also aggressively using glutathione. Again, using the Trifortify product that I talked about earlier by Research Nutritionals, a liposomal glutathione product. And if I've got people herxing, I'm having them do a teaspoon twice a day, okay? And my hope is that I'm going to be able to get them move through the increased dosing more rapidly, even than what Dr. Ligner did. And I'm hopeful that I can get them to higher doses that might be more effective, okay? Now, with the disulfiram, we have two major side effects that we have to be concerned about. One is people can develop neuropathy, okay? And that could show up as numbness, tingling, nerve injury, for instance, okay? And it's reversible if you stop the disulfiram. The other thing that can happen is there's people that are reporting some psychiatric problems like psychoses or worsened depression or worsened anxiety, okay? And so I'm warning my patients about that. I'm trying to use it on people that already have some anxiety and depression, but usually I'm making sure they're on some medicines to manage those at the same time. And I'll be able to report back later as to whether I think that's okay to do or not, okay? All right, in terms of the neuropathy, one of the things that might be helpful for the neuropathy is to be on zinc somewhere around 100 to 150 milligrams a day. And we think that one of the things that's happening with the disulfiram is it's interfering with copper metabolism and therefore the balance of copper and zinc in the body. And if you put more zinc in, that may help it. I will tell you, it's more of an opinion though. There's no research that documents that is the best way to use it, okay? All right, so my overall opinion of disulfiram is I think it has provided a very useful tool to get a lot of people much better. According to Ligner's results, 5 out of 31 patients were able to get into remission using this. I'm hopeful that we might get more if we can use the drug more aggressively, and that's what I plan on doing in my practice. But to use it more aggressively, I'm using zinc at high doses, and I'm also using glutathione, as I just explained, and curcumin too, okay? I think it can help Babesia. I'm still trying to decide whether it's going to be a useful treatment for rifampin. And then also for Bartonella. And in my practice, I am not using disulfiram. On some patients, I'm using it as a single antibiotic. There are other patients that I'm with their consent, I am using other antibiotics at the same time as the disulfiram to see if we can get better improvements that way too, okay? Do I think it is going to be the drug that cures everyone for Lyme? No. Do I think it's going to give great possibilities of improvement in many people? The answer is yes. Do I think it is something that can get a lot of people into remission? I do think the answer is yes on that as well too. Okay, that's a lot. I hope that gave you the information you wanted. Okay, and again, I'll probably that video, that clip, the things I just said there, I'll probably turn into a video clip, which will become my new disulfiram article. Okay, all right. Good luck, everyone. Good luck to you, Angela. Hello, Judith. Judith says hello, and I'm just saying hello back. I'm not going to post that. Oh, I guess I just posted it. I meant to delete it. There's the delete. There we go. Hello, Delfinio. Let's see. Hello, Dr. Ross. Thank you for replying last week. So after being on clarithromycin, nystatin, and LDN for a year, finally my naturopath changed antibiotic to doxycycline, 100 milligrams twice a day. My white blood cell have been low since I got 6. Is this normal for Lyme? The answer is some people with Lyme actually do have low white blood cell counts, okay? Often that can improve as you get further into treatment though, okay? Probably has something to do with Lyme causing immune suppression, basically, okay? All right, let's see. Also, my DHA sulfate is high at 440.2, thyroid stimulating 1.1, reverse T3 20.4, T4 direct 1.73, and T3 at 3.3. Can I take ashwagandha to treat this? My question would be, so that DHEA is high, and the DHEA is made by your adrenals. I I guess I would probably one thing I would want to make sure is that I would probably recheck the DHEA to make sure it wasn't a lab error. I've seen that happen before. Okay. The only concern I have with the ashwagandha is that because it stimulates your adrenals, it may lead them to even make more DHEA. Okay. On the other hand, though, your adrenals may be overproducing DHEA because they're stressed, and an ashwagandha can help the adrenals calm down when they're stressed too. So you may get benefit out of it. I would probably go ahead and give the ashwagandha a try, but then after you've been on it for about a month, I would think about retesting the DHEA and see what the level comes out at. Okay, all right. Let's see here. So ashwagandha, everyone, is something that I like using for adrenal and thyroid support. And I like using it as a 400 to 500 milligram pill, 2 pills in the morning and 2 pills between 1 and 2. Animal studies show that it can help both thyroid and adrenal function. Okay, so that's why I wind up using it. All right, let's see. And lastly, CMB has been high at 0.85. This has been causing me more frequent breakouts and symptoms. CMB. I am not sure what you mean by CMB. I'm sorry. I can't comment. We'll take a look at it when I see you in the coming week. We'll have to see what that lab is. I'm not familiar with just the way you wrote CMP. Oh, well, no, I'm not sure what you mean. I'll have to see it on the lab report to make sure I understand what that is. Okay. I look forward to helping you when you come. All right. Take care. All right. Hello, Stacy. Hello. Just a minute here. I got to get some water in. Let's see. Hi, Dr. Ross. Thank you so much for the help. My first symptom was a left eye twitch, then heart palpitations, then backache, nerve pain, and tingling in arms and feet. After a few months, I tested positive for 2 Lyme antibodies and was put on 3 weeks of doxy. 2 weeks into doxy, I developed aching, tingling in my face, jaw, and teeth. I have no cavity teeth issues, and my heart felt a bit worse after finishing doxy. My heart seemed slightly better while on it. 1. Does this mean that the Lyme is in my heart, brain, and teeth, or could the heart palps be caused by Lyme affecting my thyroid hormones? A cardiologist examined my heart palpitations for a week with a monitor and said the regular beats I'm having weren't dangerous. 2. Does developing jaw teeth pain while on doxy mean I shouldn't try antibiotics again, or could jaw teeth pain be a lasting doxy side effect? I've started otoba and cat's claw, but I'm unsure if I should try antibiotics again at the same time. And 3, is Nutramedic's brand effective for otoba and cat's claw? So the third part is the easiest part of your question. So the Nutramedic's brand is a good product for otoba and cat's claw. The trouble is they're very expensive. I like using a brand called Wildcraft Herbs for my cat's claw because it is much more cheaper and I think just as effective. The Wildcraft Herbs also used to have otoba, but they lost their supply chain and can't get it anymore. And so for that reason, I am recommending that people for the otoba use the Banderol product from Nutramedix. Okay. All right. And then in terms of, does this mean that Lyme is in my heart, brain, and teeth, or could the heart palps be caused by Lyme affecting my thyroid hormones? In terms of the heart palpitation, Lyme could have been causing that by infecting a nerve called the vagus nerve that comes out of the back of the head here. And it is in the vagus nerve are epinephrine, or adrenaline and anti-adrenaline nerve fibers, basically, or we call that the sympathetic parasympathetic nervous system fibers. And it could be that Lyme had infected that, and as part of a killing reaction, you were getting some triggering of your heart to race. And yes, Lyme could infect your various hormonal systems, but also Lyme could alter how they work by releasing inflammation chemicals your immune system in dealing with Lyme could be releasing inflammation chemicals called cytokines that are interfering with how the adrenals and thyroid work as well too. Okay. And then in terms of your question, could Lyme be infecting all those areas? So Lyme, within minutes or within a day or so of being in the body, has pretty much gone throughout your whole body. Lyme is never just isolated to one organ, but generally goes everywhere. Okay, so the answer, not because of what your symptoms are, would I say it's in those places, but just because Lyme goes everywhere, the chances are it's in those places that you asked your question about. Okay, and then number 2, does developing jaw teeth pain while on doxy mean I shouldn't try antibiotics again? Or could jaw teeth pain be a lasting doxy side effect? So I'm not quite sure why you got the jaw and tooth pain. It could be you had a herx reaction from Lyme germs living in those areas. I would not attribute it as a direct side effect of the doxy, nor would I keep it limit me from retrying antibiotics with you again if you were to be a patient of mine. Okay, all right, all right. But obviously, talk these things over with your specialist as well too to see what their thoughts are on it too. Okay, all right. Good luck to you, Stacy. Thank you for that question. Hello, Emily. Hi, Dr. Ross. Thank you for the informative Lyme streams. You're welcome. I really enjoy tuning in to watch them. I would like to ask, is Lyme disease able to aggravate spinal disc and mimic a disc slip? If so, how can the aforementioned symptoms be improved? A couple of weeks ago, I simply sneezed and then had shooting pain in my lower back and then completely crippled my movements for a couple of days, all from a sneeze. I am able to move and walk small distances now, yet I am still incapacitated to some extent. Walking, sitting, and lifting objects, I'll put cumulative strain on my lower back area. For clarification, I've been dealing with diagnosed chronic Lyme for 4 years since I was 14, but have never had anything this absurd, somewhat comical happen. Thank you, from Emily. So Emily, the one thing we have to be careful about, it's a good question, and then I'll just make an overall comment. So the one question we have to be careful about in Lyme disease is not to put our Lyme blinders on and think that everything is caused by Lyme. And it's an easy thing to do because Lyme can cause so many things, okay? So I have not seen Lyme to give disc disease, all right? I have had patients, and even when I was a family physician, so long before I started managing Lyme disease decades ago, it seems like decades ago, but I managed my first patient with Lyme in 2004, okay? But long before that, I was a family physician. And I can tell you countless times of people I've managed that sneezed or coughed and basically threw their back out, just like you're describing. So most likely this is not a Lyme-related thing, but rather this is something that can happen to anyone from a bad sneeze or cough, okay? All right. So anyhow, I hope I don't mean to sound critical by saying that we shouldn't put our Lyme blinders on, but I have to be sure to do that. And my colleagues, we all have to be careful not to see everything as being caused by Lyme. We have to say what else could have caused this, including Lyme as a possibility. Okay? All right. Good luck to you, Emily. Thank you for that question. Hello, Lee. My name is Lee. I'm 56 years old, and I've had CLS for more than 25 years. My naturopath suspects. Lee, I'm trying to see if there's a question here. Lee, I don't see that there's a question that came through with this. So good luck to you. I'm sorry, I don't see a question to respond to here. Okay? All right, good luck. Hello, Patricia. Hello, Dr. Ross. So grateful for your website and opportunity to ask these questions. You're welcome. I'm glad you're getting some benefit from it. Let's see. I have been treating Lyme and mold for about 18 months. My last mold test showed all types resolved except ochratoxin. My doctor, a Lyme literate naturopath, attributed to food. He recommended waiting 3 months and retesting before additional treatment. Now that I think about it, this seems crazy. Would you agree? I was on your site and found information on mold treatment, but not the specific binder for this type of mold. Please tell me where I can find it. I have the HLA gene. I do have some GI detox on hand. Also, do you think spending $600 a month on supplements is excessive or to be expected with treatment? Generally, I think that's excessive. Now, I will tell you, there are people in the integrative medicine and functional medicine world that will use a supplement for everything. Okay, I don't tend to be one of those. I do use a number of supplements in my practice, but generally, I would describe myself as being more of a supplement minimalist. I think the problem is when we start getting into using a lot of things and throwing everything at a person, we can get into even supplement interactions. And we also design treatments that are too expensive. And I try to put together things that target the most effective things that should be dealt with rather than dealing with everything. Okay, so that seems to be a bit much to me. I don't know your full story to know whether it's a good idea for you, though, because I don't know your whole history either. But on the surface, that does seem to be a bit excessive. Okay. All right. In terms of the article, let me just show it to you real quick. So in my article on mold toxicity, I have included information about which binder for which mold toxin. Okay. So take a look at my chapter on detoxification. Take a look at my article on mold toxin illness. And then you want to scroll all the way down here where I have a section on general binders and specific binders, okay? So in here, second sentence, ochratoxins are bound best by cholestyramine, which is a prescription, and activated charcoal, okay? That GI detox does have some charcoal in it, and so it could work, or you could work just with activated charcoal by itself, okay? Down here in the article, I talk about binders based on testing, and I give you dosing recommendations for activated charcoal right here. Okay. All right. Good luck to you, Patricia. Thank you for that question. Hello, Judith. Let's see. I'm anxious to find out what to do about Bartonella, a co-infection of Lyme. Have you heard anything about methylene blue and where to get it and how to use it? Okay, thanks. All right, so methylene blue is an agent that we traditionally have used for people that get a condition called methemoglobin, methemoglobinemia, which is a condition where basically the hemoglobin inside your blood cells is not able to hold on to oxygen if we give you, and it causes you to actually turn blue. And so if we wind up going ahead and giving you methylene blue, that takes care of the problem. Okay, that's where it comes from. All right. Now, what does this have to do with Bartonella? Well, as I said earlier tonight, there's a lot of research going on out there now in laboratories, not on humans, but in lab experiments, trying to find ways to deal with persister Lyme and also a persister form of Bartonella. All right. And one of the researchers has been doing some work in this area. Another one from the researcher identified earlier is a physician named Ying Zhang. Dr. Zhang is a medical doctor that runs a research lab out of Johns Hopkins University. Dr. Zhang has been basically doing petri dish experiments where he's growing persister forms of Lyme and persister forms of Bartonella, and then he's applying things to the petri dish and see what happens. And in one of his experiments for Lyme and in one of his experiments for Bartonella in the lab, he showed that methylene blue can treat what he calls stationary Lyme and stationary Bartonella, what we would call persister Lyme and persister Bartonella. All right. So these are petri dish experiments. Okay. These are not human experiments. And although I know a lot of my colleagues are starting to use methylene blue, at this point, as a group of physicians, I don't think we really know whether methylene blue is going to be helpful in Lyme, and we don't really know whether it's going to be helpful in Bartonella. Okay, we just don't, because we don't have enough collective experience yet knowing whether it makes a difference. Keep in mind what happens on a petri dish does not necessarily happen in a living human who has tons of a bunch of metabolic reactions going on in different chemistries than you see on petri dishes. Okay, all right. So where would you get it? Well, you might get it. You'd probably have to get it at a compounding pharmacy, I believe. I haven't tried it yet in one of my patients. The dosing that you want to use is somewhere between 1 to 2 milligrams per kilogram a day. And I think at that dosing range, you're probably going to need to have a compounding pharmacy mix it up. I am going to be eventually trying it here in my practice. As many of you know, I've only been back in practice for clinical practice now for a month after returning from my 1-year hiatus sabbatical in Austin, Texas. It is one of those newer ideas that I want to try with my patients, but we'll just have to see if it's going to make much benefit at all or not. Okay, I believe Horowitz has been using it in his practice. But Horowitz still uses some things I haven't found effective in my practice. So for instance, Horowitz, based on other research showing that stevia may work for persister Lyme, still advocates using it for persister Lyme and biofilms, but I've never found it to be beneficial. Okay, so each of us may have different experiences in our practice as well too. Okay, all right. Thank you for that question. Hello, Adrian. Let's see. I haven't had Bartonella symptoms for over 4 years, and all of a sudden have pain in the soles of my feet and night sweats. Any other recommendations besides Hutania? In terms of treating Bartonella, if this is Bartonella, and I don't know if it is, I would need to ask you a lot of questions before I make that diagnosis in you or help you make that diagnosis. But and if you do want some help looking at that, one thing you could look at is set up a visit. I'd be glad to help you do that. We can do it as one of my online consult visits where I just visit with you over the computer and I can give you some ideas on that. I'll show you how you can set that up here in a minute. But anyhow, the 2 herbs that I like using for Bartonella are to do the combination of sida acuta and Hutania. Okay. And earlier tonight, I showed you an article called Kills Bartonella on my Lyme disease information site. Take a look at that article. I talk about how to dose both of those herbs. They work about 70 to 75% of the time. Okay. All right. Then let me just do a quick screen share here. I'll show you how to set up that consult visit. Okay. Okay. And anyone can set up a consult visit with me. So I'm showing this not just for you, but I'm showing it to anyone that might want to get some input from me directly. All right. All right, so on my Lyme disease information site regarding the Bartonella article, again, you would look under infection treatment plans and you would click on this Kills Bartonella brief guide. You want to scroll all the way down here to the bottom, take a look at what I call my tier 3 treatments and take a look at Hutania as well as the sida acuta there. Okay, all right, then. If you have any interest in having a consult visit with me, take a look at my clinic practice site, which is martyrossmd.com. Take a look at my appointments page. And I offer 2 types of visits, full medical service, which is you come out here and I see you in my clinic in Seattle, and a limited consult service, okay? Take a look at the full description of both those visits so you understand what you're getting into. If you choose to do either one of them, both of them have required forms you need to fill out. And I describe both of those there. Okay. If you do want to set the appointment up, you would click this Book Now button, and then you can set it up from there. All right. Okay. Now, in terms of my 3 sites, they're all linked together. Okay. So this is my clinic practice site. If you want to go to my Lyme disease information site, you click the Lyme guide there. Okay. All right. And if you want to go to the store, you would click there. Same with my Lyme disease information site. In terms of getting to my clinic, you would click there. And in terms of finding out how to get to my store, you would click there. Okay. All right. Let me go back here. All right. Thank you for that question. Good luck to you. Hello, Jill. Hello. Just a minute here. I got to get another sip of water. All right. Let's see. Happy New Year, Dr. Marty. Thank you for all the good work that you do. Happy New Year to you too. And thank you very much. I appreciate that. I've recently had my second labs done by Armin Labs as my Lyme specialist here in Calgary, and MD internist, Dr. Ralph Hawkins, was stuck in terms of where to go next with my treatment. I had plateaued, but still suffer sometimes debilitating fatigue, anxiety, insomnia, neck pain, and skin, stomach issues, including a complete lack of appetite. My labs came back negative for Lyme, Babesia, and Bart. I had previously tested weak positive for Lyme. After being treated for years in the States, Canada, and Montana, okay. So he says I am in remission. How can this be if I still have such severe symptoms? He refused to put me on Disulfiram and currently has me on no meds except LDN. I was off my doxy and Plaquenil for 4 months to prep for testing. Any insight? He is going to drop me from the clinic, and I'm very worried. All right. So, Joe, I disagree with Dr. Hawkins on his approach, okay? Having said that, I will let you know he's under extreme scrutiny, and he, unfortunately in Canada, he has to do some limitations on how long he treats people. And so he's using this testing as a way to limit and end treatment, but I don't think it's a fully accurate way to do it, okay? So now, having said that, let me explain why, okay? So what Dr. Hawkins is doing is he's using Armin labs, and I know a number of my colleagues use Armin labs to decide when they're going to stop treating, and I just don't think it's a good thing to do. All right, so let's talk about it. So Armin lab does a type of test called an ELISpot test. And what an ELISpot test is, it's a way of seeing, do a type of white blood cells in you called T cells remember seeing an active infection within the last 2 months, okay? So your T cells, which fight infections, live for about 2 months, except there's a kind of T cell which is a memory T cell that may last longer. We don't know how long they last, okay? But the T cells that actually circulate in your blood last for about 2 months. And so when we do this test, we take T cells from your blood, and for the Lyme germ, if we're testing for Lyme, what we do is we take those T cells and we expose them to Lyme proteins, and we see if they remember Lyme by releasing cytokines, and we measure those cytokines, okay? And if you have an elevated cytokine level after we expose them to Lyme proteins, that's a positive test, okay? Same thing for Bartonella. We take Bartonella proteins, we expose them to your T cells, and we see if they release cytokines. And same thing for Babesia, all right? Now, the problem with this, what Dr. Hawkins is assuming, is if the test comes back negative, that means that your immune system is no longer seeing the Lyme germs and therefore no longer releasing cytokines when it either to Lyme or to Bartonella or Babesia, whatever the ELISpot test is he's doing, okay? The problem is, there's a problem with that. Number one, if your germs are very active, they may be suppressing the immune system to the point it cannot fight the infections or react against the infections, okay? All right? So a negative ELISpot may mean your infection is so bad that you have severe immune suppression and your immune system can't respond, all right? Number two, Lyme and Bartonella especially have the ability to form persisters, and they may be hiding in biofilm communities and in tissues far away from the immune system where the immune system can see it. So you may not be getting a reaction on the ELISpot test because the immune system just can't see the germs because they're hiding so well, either under biofilms or in tissues where they just have poor blood flow, okay? All right? So I don't agree with this practice that many of my colleagues are doing of following ELISpot testing to see where you are. It's an idea that has been proposed by Dr. Armin Schwartzbach of Armin Labs, and I've had discussions with him, strongly disagreeing with him, and I strongly disagree with any of my colleagues that are doing this. The truth is, we do not have a where are you in your Lyme disease treatment test. We don't. We don't have a test that says you're done. There is no such test. There is no test that says you're in remission. And I strongly disagree with Dr. Hawkins, and I strongly disagree with any of my colleagues that are using that as a way to do it. Your symptoms, to me at this point, still suggest you have some active infection going on, okay? And I think in terms of Lyme and Lyme disease co-infections, especially Bartonella, I think that's the best we can do is to look at the symptoms as a guide, okay? All right, now, having said that, I do treat people from across the border. And so if there is any interest on your part, I don't think, based on what you said here, that I necessarily would stop treating, okay? So you may want to take a look at that appointments page that I just showed everyone earlier at martyrossmd.com and see if that's something you might be interested in doing, okay? All right. Good luck to you, Joe. I'm sorry that Dr. Hawkins is doing that. But I understand Dr. Hawkins has heavy scrutiny treating Lyme in Canada, where a number of doctors have lost their licenses for managing it. And even though I got attacked by my medical board here, I somehow managed to keep my license for managing Lyme. Up in Canada, it's a lot more dangerous. Dr. Hawkins has been able to try to keep his board at bay by showing that he has some type of a scientific rationale and testing rationale for what he does. And that's how he's able to keep treating. So he has to be more careful to limit the lengths of his treatment up in Canada, unfortunately. Okay? All right. Good luck to you, Joe. Hello, Anna. Hi, Dr. Ross. I was diagnosed with chronic fatigue syndrome, myalgic encephalitis, which is chronic fatigue. So the Europeans call it myalgic encephalitis. Here in the States, we call it chronic fatigue syndrome, okay? They're the same thing. 3 years ago, and my doctor recently told me I was positive for Rickettsia. I have 2 questions. Should I be worried about Lyme given the Rickettsia diagnosis? My ELISA was negative. And 2, my doctor said that my body was fighting off Rickettsia by itself. Should I ask for treatment or let my body fight it off? Thank you. Okay. So having Rickettsia means you have been bitten by a tick somewhere in your past. Okay. Could that tick have transmitted Lyme? Yes. Could that tick have transmitted other tick-borne infections like Bartonella, Babesia? Yes. Okay. All right. Now, in my practice in Seattle, Washington, in 2004, my practice was predominantly a practice devoted to treating people with chronic fatigue syndrome and fibromyalgia. At that point, I was not yet a Lyme disease specialist, nor was I treating chronic Lyme disease, all right? In 2004, a patient of mine asked would I test her for Lyme disease, and I did, and her test came back positive. She was one of my chronic fatigue fibromyalgia patients, okay? So that caused me to do a little bit of soul searching. And I decided at that time to go back and retest all of my patients to see could anyone else have that had chronic fatigue and fibro, could anyone else have Lyme disease as an underlying cause of those symptoms that we were calling chronic fatigue and fibromyalgia. And what I found in my Seattle practice was 30% of my patients that I had previously said had fibromyalgia chronic fatigue syndrome actually had Lyme disease, giving all those symptoms that looked like fibromyalgia and chronic fatigue. Okay. All right. That's in my practice in Seattle, Washington. Now, we don't know in the state of Washington what percentage of our ticks carry Lyme. No one's done the studies here. South of us in California, way south of us in California, around 40% of ticks in Northern California are shown to carry Lyme. And we live on the same bird flyways. So those ticks jump on birds and they go flying. And they fly across the states, and they wind up here in Washington state, where we probably have a tick population that may have anywhere from 20 to 40% of the ticks could have Lyme up here, all right, based on those California studies. But no one's done the studies to know for sure, okay? Now, out in New Jersey studies here in the States say that about 95% of ticks carry Lyme, okay? And what that means is in New Jersey, people that are being told they have fibromyalgia and chronic fatigue, probably a large percentage of those are actually Lyme disease patients. So out here in Seattle, where we have a lower chance of running into Lyme and infected ticks, my practice said 30% had Lyme causing their problems. I suspect because there's so much more Lyme out on the East Coast that it's a higher percentage, like maybe 40%, maybe 50% of people out there that have been told they have fibromyalgia and chronic fatigue might have Lyme, okay? In terms of in Europe, I don't know. I don't have any idea on what the percentage of ticks are that carry Lyme in Scotland or in the UK, for instance. I just don't know, nor do I know in Germany. Okay, so I wouldn't be able to make a comment on that there. Okay, all right. And then one other comment. The ELISA test that you had, if you have chronic Lyme, is a horrible test. It might be a good test to see if you have Lyme in an acute situation. But there are numerous studies that show that in a chronic situation, that its ability to find Lyme is only about 50 to 60%, meaning it will miss it 40 to 45% of the time, okay? And that type of a situation, my preferred test to do is an IGeneX test called an immunoblot that has the ability to find Lyme if it's present about 95% of the time, okay? In terms of reading about Lyme testing, I'm going to show you an article that you can look at that looks at all the ways you can test for Lyme and is something you could print off and even bring to your doctors to say, I want the IGeneX immunoblot test, and here's why. Let me show you that article, okay? All right, so take a look at my section here in Treat Lyme by Marty Ross MD. Take a look at this section called Test. All right, and take a look at this article called A Review of Lyme Infection Test, Pass or Fail. All right, and in here I talk about why the ELISA is a horrible test, and I give it a grade of an F, okay? The newer immunoblot, this has been about a couple of years now that IGeneX is offering it, I give it a B, all right? And then the standard Western blot, the Western blot, I give a B. And then the newer immunoblot from IGeneX, I give an A-, okay? I should say that, okay? But take a look here. It explains the ins and outs of doing Lyme testing, all right? And this is something, if you just do a right click on your computer, you could then hit print and then it will print off the article for you, okay? All right. Anna, good luck to you. Hello, Barbara. Let's see. This is Barbara Velmerk Halpern. No direct question tonight, but to let you know that the local big paper carried a long article today that a singer, well-known apparently Justin Bieber, announced that he has Lyme disease and intends to make a documentary about it. Let's hope that this brings more attention to our dilemma and that he finds you for healing. Thank you for all. Barbara, thank you for letting me know that I'm aware of Justin Bieber having this as a diagnosis. You know, I guess I'm sorry, you know, celebrities get this stuff too, right? I mean, if we look at Chris Christopherson has it, we look at Justin Bieber, who is the more female Canadian singer who recently was told she had it. I can see her image. I just can't think about it. Now, Shania Twain had it. We've got one of the Beverly Hills housewives, Yolanda, had it. I mean, there's a lot of celebrities. I hope it does bring more attention. I am sorry for any celebrity or any human that has this illness. I don't know that it's going to be anything that's going to shift the major tide for us, though. Okay. But thank you. I appreciate the comment. Hello, Stephanie. Let's see. I just started Lyme treatment this week. My doctor prescribed Plaquenil and doxycycline. She says new research shows Plaquenil is a biofilm buster. Do you agree? You know, I haven't seen that newer research. I know. So Plaquenil, everyone, is a medicine that we traditionally use to treat. I'm blank. It's getting to be a long night here. Used to treat malaria, okay? It's a quinine-like medicine that we use to treat malaria. Historically, in Lyme, we have used it because it also changes acid levels in cells and can sometimes help medicines that work inside cells, like the tetracyclines, which is minnow and doxycycline, and the macrolides, like Zithromax and Biaxin. It can help those work better. In addition, there is some older science that shows it might break up the cyst form of Lyme, but there was controversial studies that also showed it may promote cyst formation, so therefore I stopped using it. There is a newer study that came out showing that it might be able to help with persister forms of Lyme, and I really was just looking at that earlier today and had just scratched the surface on it. I am not aware of in that same article they say it busts up biofilms too. But keep in mind, any of these articles that say it might do something are all Petri dish experiments. And again, we don't know if they do anything in humans, okay? So I need to look a little bit more, but there's a whole article that I saved to read article talking about potential benefits of Plaquenil for persisters. One of the things I think is it may change the cell membrane of Lyme, making it more susceptible to die. I have to see if in that article they talked about biofilms. I'm just not aware of that. All right? All right. Thank you for that comment. Hello, Karen. Hello, Dr. Ross. Well, hello back to you. I appreciate that. Let's see. I have symptoms of Bartonella and have been seeing psychiatrists for 10 years getting various horrible diagnoses, but no one can help me. I now follow your Lyme support guide. That is a lot of pills, but thank you for putting that together. It's very helpful. I did GemSec protocol of amoxicillin, minocycline, Bactrim, tinidazole for 1.5 months and stopped terrible herxing. Went on Rawls for 3 months, but recently started back on my own with Bactrim, amoxicillin, and minocycline, seeing some small progress. 2 questions. All right, actually, before you do the 2 questions, I want to just make a comment. So unfortunately, Dr. Rawls' protocol doesn't deal with Bartonella at all. It doesn't have an adequate way of addressing it, okay? So I just want to let you know you haven't been treated for Bartonella with Rawls. Dr. GemSec likes to pulse his antibiotics, and which I think may be beneficial for the Lyme germ, I don't think is a good way to pursue Bartonella. And the reason I don't think pulsing, starting and stopping your antibiotics the GemSec way is useful for Bartonella is that Bartonella replicates every 24 hours. That means in the period that you're off of the antibiotics, it's coming back, okay? And I've taken a number of people that were treated by GemSec that were having a hard time getting through their Bartonella, and they just changed their treatments by going on continuous treatment. And guess what? Their Bartonella got better, okay? All right, so those are comments just about those 2 protocols, okay? All right, and then let's see. First, would you recommend different antibiotics than what I am on? And second, I lay around exhausted, sick, and moan all day in pain. So I sometimes take 20 milligrams of dexedrine for energy, which gives me the energy to get out of bed and do things. Unfortunately, it causes dystonia-like symptoms, which are horribly painful. Is there anything you could recommend for energy? I have tried cytokine, ATP 360, and modafinil, but they are not able to take me up and get me out of bed like dexedrine. Thank you for taking my questions. Okay, so in terms of your first part of the question, first, would you recommend different antibiotics than what I am on? What I would say is the Bactrim and minocycline are a combination that can work for Bartonella, okay? And if you're already starting to get some benefit on it, I wouldn't change that. The amoxicillin is useful for treating the spirochete form of Lyme. Minocycline is useful for treating spirochete Lyme and also Lyme that lives inside of cells. Bactrim may have some benefit against persister Lyme, okay? But in terms of the Lyme germ, you're missing one part, and that is you're missing something to treat the cyst form of the Lyme germ. And so if you were a patient of mine, I would probably be adding grapefruit seed extract, 250 milligram pill, 1 pill twice a day to treat the cyst form of Lyme, okay? All right, now, in terms of energy, things that can help energy in terms of supplements and prescriptions, number 1, ashwagandha, sometimes can. It supports the adrenal glands. It's been observed in Ayurvedic medicine and Chinese medicine for centuries to give energy to people that are under stress, okay? And that would be a 400 milligram pill or a 500 milligram pill, depending what brand you're using. And you want to do 2 of those in the morning and 2 between 1 and 2, okay? Your ATP 360 is going to be working to repair cell energy factories called mitochondria, but using it can take about 2 months at a minimum before you start seeing improvements. And that would be to use the ATP 360 as 3 pills 1 time a day for a minimum of 2 months before you're going to start seeing some improvements out of that, okay? And then if those fail, then the next way is to use your stimulants like a dexedrine. And there is just sometimes you wind up having to do it, okay? All right. Let me show an article where I kind of review some of that. I'll show this to you here. All right. Take a look. I think, yeah. It's an article I wrote called Too Tired, Try These Top Energizers. And in here, I talk about NT factor, but the comments I make about NT factor here would be the same as ATP 360. This is a way of rebuilding your mitochondria covering, okay? Ashwagandha is another way. I just talked to you about that. Being on a good multivitamin sometimes can help. And then finally, sometimes we just have to use the stimulants. And I put that as the fourth possibility here, okay? All right. All right. Karen, thank you for that question. Good luck to you. Hello, Joyce. Hi, Dr. Ross. Do you know which tests are best to find out what is going on with muscles other than checking creatinine levels? I have had Lyme almost 20 years. Early on, I was told that 3 to 4 weeks of doxy was enough. In 2016, I got very sick and began treatment with a Lyme specialist on the East Coast. I moved to Arizona 2 years ago and started experiencing muscle pain, predominantly upper body. Thank you for all your help as always. So unfortunately, I don't have a good test to see why you're having muscle pain. A starting point for muscle pain, though, that I try in most of my patients is to get on magnesium. And I prefer magnesium malate or magnesium malic acid. The malate form seems to be better for muscle cramping. I would start by trying to rebuild magnesium stores first. If you have low magnesium, you're going to have muscle achiness, okay? And our food generally is nutrient short, nutrient deficient, and our soils are nutrient deficient, therefore our food is. And so sometimes just starting with supplementing magnesium at about 400, 600 milligrams a night before bed can be enough over a month or two to rebuild magnesium stores, and you stop having muscle pain then, okay? That would be something to consider, okay? All right. Thank you for that question, Joyce. All right, everyone, that's it for me for tonight. It's been a good time being with you here tonight. As many of you know, I think I told you in previous webinars, I've been having a hard time getting my lighting changed with that white wall behind me. It's been a little bit of a problem, but I think I got it balanced out a little bit better, making some changes in my lighting system, although I think I'm a little bit washed out here tonight, but we'll keep making adjustments over the next week or two. Keep your eyes out in tomorrow's email. You'll get an email from me saying the recording is ready somewhere around 9 to 9:30 a.m. Pacific Standard Time, Seattle time. All right. And then in that email will be a link that you can sign up for next week's webinar. And we have one next week and the week after. Okay. I look forward to visiting with you guys again, you guys and ladies, I should say. And good luck, everyone, as you keep recovering from Lyme disease. All right. Good night, everyone.